Good morning. Welcome to Farm 3. Last one, and it's a shorter video today. You'll be glad to hear that after the last one is really long. Today, we're going to go over some numbing agents, a bit of antifungals, and some closing thoughts. As always, make your own notes. Watch the PDF on your one device. Watch this video on a different device. Go slowly. Get them all at rdhblueprint.ca, and let's get started. Chapter 3. Local anesthetics. We went over this, but because it's going to be on your board exam, probably, I'm going to go over it again. You need local anesthesia for numbing, right? We block the pain sensation. The mechanism of action is on that chapter, right? LA, go watch that video. Nitrous oxide, that's your laughing gas. We put that on to help her feel better, right? It's nitrous oxide. And antifungals, things that help fight fungi, right? Athlete's foot, we used creams and antifungals and creams to stop fungus from going. Local anesthesia. What do we need to know? The epinephrine dose might need to be lower depending on their medical condition. So if they have a heart problem, instead of normally having, say, 0.2 milligrams being the daily limit, it's 1/5 of that amount. So 0.04 milligrams, right? 20 divided by 5 is 4, so you have 0.2 milligrams divided by 5 is 0.04 milligrams. Memorize that number if they have a heart problem. If they're taking tricyclics, right, TCAs for depression, again, we're going to have a lower amount. Diabetes, how does that impact how much LA we're given? Well, if it's controlled, you're fine. You just proceed as normal. But with uncontrolled diabetes, that means their blood sugar is not stable. Look for a board exam question that might say a person recently diagnosed or having symptoms of diabetes, and that tells you, okay, if it was just diagnosed or you're just having early symptoms, it's not controlled. Then I know we need to have a lesser amount. But if it's controlled diabetes, the blood sugar levels are stable, it's fine to use epinephrine as normal, the 0.2 milligrams. But if it's not stable, you can use less, 1/5 of the amount. So look very careful on the board exam for controlled versus uncontrolled. This makes all the difference on how we proceed. So, what do we need to know? A simple overview of the numbing agents. Articaine, it's broken down very quickly in the blood. See, it's traveling down the blood and it's getting broken apart. That's what makes it so special. It's not metabolized really in your liver. Like over 90% is done in the blood, which is great. Give the liver a break. Prilocaine, this one is partially broken down in the lungs, which is nice. But we have to be careful because it can cause methemoglobinemia, which is a big, big word, right? So just know methemoglobinemia. It can cause that pilocarpine. Lidocaine. Lidocaine is a very common numbing agent for pregnancy. See the baby in here? Baby's very happy because they're getting lidocaine. It's sort of safe to use during pregnancy, which is called category B. I think B for baby. Mepivacaine is different because it's not using epinephrine as the vasoconstrictor. It's using levonorepinephrine as the vasoconstrictor. Bupivacaine is the long-acting. Let's see the hourglass here. Long-acting. Take 5-10 minutes for the onset, whereas the other ones are less than 5 minutes. But it can last for hours. Nitrous oxide, or laughing gas, makes you feel calm and less anxious. And what's nice is we exhale all of it. There's no residual waste within our bodies. We completely expel it when it's done. So after treatment, you must give 100% oxygen for 5 minutes to prevent diffuse hypoxia. So we get rid of it. It's not as strong as anesthetic. It won't really make you feel numb or put you into deep sleep. It's a mild calmness. It won't treat severe anxiety, just mild. It's very safe. It does not make you breathe less or stop you from breathing. It's a good choice who need a mild or calming effect. Antifungals, you need to know this. So we have nystatin, that's the most common. And fungals are hard to kill because their cell membrane is very similar to ours. So they're very similar to eukaryotes. So with all of that said, we normally kill things by attacking their cell wall. That's how we're going after bacteria most of the time. And so with fungals, to attack their cell wall would be attack ours. So we'd kill both. So here we have nystatin, and the mechanism of action isn't important. Just know it's a liquid suspension. You swish with it for a while, then spit it out, or actually you don't spit it out, you swallow it, so it'll get down your throat as well. Right. Get rid of white patches in the mouth. The other ones. Well, I hope you enjoyed this preview of this lesson. For the rest of this lesson, PDFs, quizzes, study guides, and more, head over to rdhblueprint.ca. You'll find everything you need for the dental hygiene board exam in Canada and get you ready for the NDHCE. See you there. Bye.